following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, heart health. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. High cholesterol, high blood pressure, excessive weight, and a sedentary lifestyle are just some of the risk factors for developing heart disease. It's the #1 killer of American men and women, and experts say that our children are even more at risk than we are. How are heart problems diagnosed? What can you do to keep your kids healthy? What are the latest treatment options for blocked arteries? We'll get answers to those questions and more tonight from our two guests, Dr. Anthony Marisi, a cardiologist at WVU, who specializes in diagnosis of heart conditions, and Dr. Malik El-Yamen, a pediatric cardiologist at WVU, who specializes in caring for children with heart problems. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Tony, for sure, lifestyle factors weigh into who's going to develop heart disease.
Yes, factors such as activity, sedentary lifestyle, diet, big problem, as well as habits that people pick up, such as cigarette smoking. Those are probably the biggest ones that people have actually control over in their lives. They can start off by eating a poor diet, have poor activity habits, and start things such as smoking, which definitely will have an impact on their life and their heart health later in life.
So these are all things that people do that lead to heart disease. But Malik, you and I are pediatric cardiologists, and we deal with patients with congenital heart disease. What's the difference?
So congenital is something that you're born with. So when we say congenital heart disease, it's really a big spectrum of problems. It could be something very minor, like a hole in the heart. A lot of these things can be watched and not necessarily have something done for. But on the other end of the spectrum, there are things that are very complex, like a missing valve or a very underdeveloped pumping chamber, and those are things that definitely would require a lot of complex surgery and things like that. But these are things that are just present in about 1% to 2% of live births, and it's nothing that people did or nothing that mom ate or did during the pregnancy in most of these cases.
But now our two fields are starting to cross over more because patients born with congenital heart disease are actually living into adulthood as well. So they have those lifestyle modifications that they'll need to think about as well. So what would you say that the #1 symptom is that you see or adults should be concerned about with their health?
The #1 symptom clearly is chest discomfort or pain. Some people don't have pain. They'll have some kind of a symptom that is unpleasant in their chest that they have trouble putting words to. I'll just say it's like a smothering or pressure or a weight on their chest. And that could be a symptom of heart disease. Doesn't always have to be heart attack type disease, but heart disease can present in that way with chest discomfort. The other second common symptom is shortness of breath, which overlaps with lung disease as well. But shortness of breath can be a secondary symptom of heart disease.
Is there something specific about the chest pain that someone should be watching out that would lead them towards it being the heart instead of the lung?
It can be a very vexing problem to track down, but typically heart pain, it comes on with exertion and is relieved by rest. And typically can be anywhere in the chest, anywhere from the top of above the belly button up to the angle of the jaw. So you really can't pin a location, but the classic area is right in the middle of the chest.
And for sure, if someone has that, they need to see their doctor soon.
Sure.
Now, young folks, adolescents, and teenagers, they have chest pain quite often. You see that in your office a lot. What's the difference between their chest pain and an adult with chest pain?
Right, so it is a very common symptoms in growing children and teenagers, and I guess the happy part about our specialty is that most of these children do not have a heart problem. At the end of the day, we reassure most of them that in fact their chest pain is non-cardiac in origin. Over 95% of these kids are going to be perfectly normal from a cardiac standpoint. So things like chest wall pain from the ribs or ligaments in the chest can cause chest pain, asthma, acid reflux. But really our job is to sort throughout their symptoms, and just like Tony said, we have to really get a good story about what is exactly the chest pain like, what is causing it, what are some of the relieving factors, and a lot of times just by a good story we can sort out what sounds like cardiac chest pain and what doesn't.
Okay. Now the workup is about the same. Where would you start with a patient with chest pain? What do you think they need?
It kind of depends on what kind of baggage they come along. If they come with a lot of factors that would play into, say, coronary artery disease, hardening of the arteries, it's like if they're diabetic, if they smoke, then we would have a much higher suspicion, and we might move them right up to the top of the lane and go right to the catheterization lab. For people where the concern is not so great, then we have these non-invasive stress tests that we do of a variety of different types, all the way from the simple treadmill EKG to very complex imaging procedures that we do to try to see the heart in more direct depth.
Okay. Our first caller is Ed from Fayette County, Pennsylvania. Ed, welcome to Doctors on Call. Do you have a question?
Yes. Here a while back I had all my arteries checked in that large area where they put you in there for a couple hours, and my report said I have left ventricle fracture 61%.
Okay. So I think what Ed may be referring to is his
ejection fraction, as it's referred to. That's just the fraction of blood that's contracted with each beat. And 61% is actually in the normal range, Ed, and usually anything below 55 is considered abnormal, and then the further low it goes from there, the more abnormal. But 61% is normal.
Okay, so what Ed was talking about is an echocardiogram, and looking at a way of quantitating the function of the heart. Can you tell us a little bit about that?
Yeah, so it's basically ultrasound. So it uses ultrasound technology to look at the heart muscle, make sure that everything is formed correctly as far as the heart valves, the muscle, and then we also quantify function of the heart using different techniques. One of them is the simple measurement of an ejection fraction, or how much of the blood is ejected with each heartbeat. And ultrasound has really revolutionized the way we do both pediatric cardiology and adult cardiology, because it's very portable, it's non-invasive, and it really gives us a very good look at the heart in most cases, I would say.
Okay, very good. Well, good luck to you, Ed. Our next caller is Phyllis from Lawrence County, Ohio. Phyllis, welcome to Doctors on Call.
Hello.
Hi, go ahead with your question for our experts.
I have been told that I have a heart murmur, and I was wondering what causes them.
Excellent question. You want to start, Tony?
Heart murmur is the flow of blood that is audible, that you can hear with a stethoscope generally. The physician will hear it. It generally will not be audible or heard by the patient themselves. And a murmur can be, in most cases, totally innocent and benign. On occasion, we do find a murmur that really means something serious in terms of a heart disease. But that's the big $64,000 question when they come with a murmur. Is it something serious, or is it something innocent?
And what are some of the things that cause heart murmurs that are serious?
Most commonly, it's a valve problem. It can be occasionally congenital heart disease that presents that way. There are some heart muscle disorders that can present with a murmur. And those are the major ones. Okay.
So Phyllis needs to start by having her doctor figure out if this is an innocent murmur or truly a pathologic murmur. Now, in pediatric cardiology, you see patients with murmurs probably even more often than adults. What do you see in your clinic?
Yeah, and the way I explain it to the families and to the parents is that a murmur is not a problem per se. It's just a sound we hear. And in most cases, it is just an innocent flow murmur. And the reason it's more common in children is that they have very thin chest walls. So when we put the stethoscope on their chest, it's very close to their heart, and we can hear a normal flow of blood in normal structures, vessels, valves. And as they grow older, a lot of these innocent murmurs fade away because we can't hear them anymore. Some of the causes of murmurs in children children are, most common cause is an innocent flow murmur. Other causes are either holes in the heart, like a VSD or a ventricular septal defect, which is a defect in between the two pumping chambers, or a leaky valve, or a stenotic or obstructed valve. These would be the most common types of pathologic or abnormal murmurs.
Okay, so if either of you here have a patient with an abnormal murmur, you're going to go to some more advanced imaging to figure out what it is. Janice from Putnam County is our next caller. Janice, welcome to Doctors on Call.
Well, thank you very much.
Go ahead with your question.
My son, who's 28 years old now, was born with transposition of the great vessels. Now that he's an adult, is there a specific kind of cardiologist he needs to see?
Great question.
That's a good question. Adults, there are actually more adults today with congenital heart disease than children with congenital heart disease, and that speaks for the success of our specialties, that a lot of these children are growing into adulthood. And who is the best person or the doctor to see your son? It really depends on the area where you live in. In some centers, they are mostly being seen by pediatric cardiologists who sort of continue to take care of these patients as they grow older. And most of us in pediatric cardiology are very comfortable taking care of older patients with congenital heart disease, such as transposition of great vessels. In some other centers, there are other specialists who are called adult congenital heart disease specialists. They are adult cardiologists, but they specialize in congenital heart problems. Or they could be just regular adult cardiologists who have taken a particular interest in congenital heart disease and learned about it in their training. So it really depends on where you are. In our area, I would say, in my experience, most of these patients are cared for by pediatric cardiologists.
Mm-hmm. Or a combination of adults and pediatric cardiologists, because as they get older, we're comfortable with their congenital heart defect, but treating gout and talking about smoking isn't our specialty. So right. A lot of times we'll interact, and there are centers that specialize in both adult and pediatric cardiology disease. So our next caller is Marguerite from Kanawha County. Marguerite, welcome to Doctors on Call.
Thank you.
Go ahead with your question.
I was wondering if I have been diagnosed with COPD, and I was just wondering if this causes a stress on the heart.
Good question.
Okay, chronic
What's COPD?
Yes, chronic obstructive pulmonary disease. It is a lung problem primarily, and it puts a burden or a stress on the right side of the heart, which is sort of the underappreciated side of the heart as far as the public goes. But it is the part of the heart that pumps blood to the lungs. And when there is COPD, it does put stress on that part of the heart. It can enlarge, it can thicken, and it can develop signs of heart failure with swelling of the lower extremities, enlargement of the liver and abdomen, those kinds of things, when it reaches its more advanced stages. But yes, it can put stress on the heart.
So the treatment then is to treat the COPD the best you can to relieve that?
It is. And there's some new therapies that are looking at treating the elevated pressure in the lungs. That's called pulmonary hypertension. There are some specific treatments that are being developed to treat that in the setting of COPD, as well as where there isn't COPD, where they have elevated pulmonary artery pressures for other reasons. But yes, to treat the lung disease first, and then, if need be, treat the effects of that lung disease on the right heart by using fluid medications to get rid of the extra fluid, etc.
Okay. Marguerite, best of luck to you. We have another caller from Kanawha County. It's Margie. Margie, welcome to Doctors on Call.
Hi, my question is, I have a heart murmur that I was diagnosed with as a child. I'm now 60 years old, and they said it would go away. I wasn't allowed to play recess or jump rope or anything. And I still have it. I'm wondering, is this causing me any problems now?
Have you ever had any imaging of your heart?
Any what?
Have you ever had an ultrasound of your heart or any pictures of your heart taken?
No.
No? So you've just had the diagnosis of a murmur, but you've never really been evaluated by a cardiologist?
No, sometimes when they listen to my heart, and they ask me, I say, well, I had a heart murmur, but it went away. And they said, well, you still have one.
Okay. So a murmur that comes and goes throughout a lifetime.
I wouldn't say that it comes and goes, but the most common congenital disorder is a disorder of the aortic valve called the bicuspid aortic valve. Rather than 3 leaflets, you only have 2. And people can live their entire lives and have that, and have a murmur be present, and it really never bothers them. Some people develop aortic stenosis, which is a narrowing of the valve, or have leakage of the valve that causes it to be fixed. But it's possible that this is what this woman had.
Sure, sure. And Malik, there are bunch of different types of murmurs. So maybe she had an innocent murmur that's then developed. So we need to follow kids, even if you've had a murmur as a child and doctor tells you it's normal. Routine follow-up is required to pick up new murmurs.
Well, I would say the routine follow-up by their regular physician. Once they've seen a cardiologist and they went through the motion of figuring out what kind of murmur they have, if we, at the end of the day, clear that this is a perfectly innocent murmur, I basically discharge them from my clinic and I don't ask them to come back unless they develop new problems. So it is unclear whether the caller, if she had a murmur that was innocent, went away and, like you said, developed something else. A murmur can be anything. So what I advise is to have this checked by somebody, by a specialist, by a cardiologist, and do imaging of her heart, and then they could tell her still that it's an innocent murmur, or depending on what they find, they will make specific recommendations.
So she may have been okay as a kid, and now she's developed something else that
right.
needs to be looked
Correct.
into. So our next caller is actually from Kentucky, Kathy from Martin County, Kentucky. Welcome to Doctors on Call, Kathy.
Thank you.
Go ahead with your question.
Okay, the question I have is, I've heard of this test called a cardiac CT calcium score, and I was wondering if you could tell me about this test and when it's needed, and is it more effective than a heart cath?
Excellent.
Okay.
Kathy brought us to where we wanted to go.
Exactly. It's basically an X-ray, if you will. It's done with a CT, and it's an X-ray test with there's no dye involved. There's no preparation. You can just come off the street and have this test done, where they actually will measure the amount of calcium in the arteries of your heart. It's not for everyone, though. It's specifically intended, according to guidelines, for people who have some concern about risk of heart disease based upon high cholesterol, family history, those sorts of things, where we would screen in someone where we're having some decisions that need to be made concerning how aggressive to be with lowering their cholesterol. And if we find calcium, then we know they have early disease, and we would treat them more aggressively. It is not as good as a catheterization. It does not tell us the degree of narrowing of a blood vessel. All it tells us is that there's calcium in the vessels, which is a diagnosis of hardening of the arteries.
And then they score?
It's a score you develop. The more calcium you have, the higher the score is. It's based upon the extent of the calcium in the arteries as well as the intensity of the calcification. So the more you have of intensity as well as the more extent you have of the number of arteries involved, you'll have a higher calcium score. And usually if you have a score between 0 and 400, we are going to talk about aggressive treatment with therapy to try to lower your cholesterol, stop smoking, maybe be on aspirin. If you have a score over 400, we're going to do some more testing to try to determine just how bad the
And then maybe you need the heart cath.
Later on you could, yes.
Okay, very good. Good luck, Kathy. Our next caller is Nancy from Wood County. Nancy, welcome to Doctors on Call. Go ahead with your question for our experts.
Yes, thank you. I'm 48 years old, and I have a pacemaker that was put in for SVT, supraventricular tachycardia, which is a rapid heartbeat. And my question is, why is it that I still have episodes of rapid heartbeat if the pacemaker is supposed to take care of that?
Is it the kind of pacemaker that can shock you out of an abnormal rhythm? Is it a defibrillator?
Yes.
It's a defibrillator.
Right.
Okay, so that's a little bit different than, you want me to take this one?
Yeah, I'll hand that to John.
So there are 2 types of devices that can be implanted. One is a pacemaker, and specifically what a pacemaker does is it looks at your heart rate, and whenever your heart goes too slow, the pacemaker kicks in to speed your heart rate up. There's another device called a defibrillator, and every defibrillator has a pacemaker built into it. So what the defibrillator does is not only does it pace when your heart rate goes too slow, but it can also detect abnormally fast heart rhythms, specifically ventricular tachycardia or fibrillation. It recognizes that you're in an abnormally fast heartbeat, and it can actually shock you and save your life from that abnormal heart rhythm. Now, supraventricular tachycardia is a fast heartbeat of the upper chamber and can be caused by extra wires in the heart that short circuit, or circles of electricity in the collecting chamber called atrial flutter or fibrillation. Pacemakers sometimes are used to decrease the burden of those abnormal heart rhythms, but rarely are they used to treat them. So I suspect that something else may be going on with Nancy, and she should probably follow up with her doctor to ask them about that. So we were talking about CT and calcium scoring. Now, in congenital heart disease, adults with congenital heart disease, you're using advanced imaging as well for some patients. When would that be indicated compared to a catheterization, say?
Right. I still think that the best modality is still ultrasound. So that's the first imaging modality that we use in most cases. But sometimes we need another modality that would give us a little bit more information, but at the same time wouldn't be invasive, like heart catheterization. So a cardiac MRI uses an MRI machine, which is just like the same MRI machine that's used for the head or the abdomen, but it has a special software to look at the heart. And we use that for specific indications. I know in the congenital world, in the world of congenital heart disease, we use it to look at usually vessels outside the heart, because those can be a little bit difficult to see by ultrasound sometimes. So if we are looking for abnormalities of the aorta, like coarctation, or abnormalities in the pulmonary arteries, the vessels going to the lungs or the veins, then an MRI would be the way to go. MRI also is the way to go if a patient has very difficult pictures. Some of our patients, particularly if they're heavy set, the pictures with ultrasound can be very difficult, and sometimes they can give us very poor information, and we resort to MRI because they can give us a much more detailed and crisp images of the heart. And then finally, MRI is good for quantification, particularly for the right-sided pumping chamber or the right ventricle, where ultrasound is sort of semi-quantitative. MRI gets a step further by giving us specific numbers for what the RV, the right ventricular volume, and the pumping function, and that could help us a lot in decision-making in specific patient populations.
And there's some adults with congenital heart disease that you can't do a heart catheterization on because their veins don't go back to the heart, and you need to use MRI to image in those cases too. Our next caller is Tom from Raleigh County. Tom, welcome to Doctors on Call.
Yes, thank you.
Go ahead with your question.
Yes. My wife recently died of what was called sudden cardiac death, and I was wondering if you could explain what that is.
How old was your wife?
She was 48.
Did she have symptoms before she passed away?
She was growing tired the last few weeks before she passed away, and she did have shortness of breath on the day that she had died.
What was she doing, if you don't mind me asking?
Just normal physical activity, nothing strenuous.
Okay, so what are some of the possibilities for Tom's wife?
In a 48-year-old woman, I think first and foremost you think of coronary artery disease. Secondly would be some kind of cardiomyopathy, which is a disorder of the left ventricle, the main pumping chamber. Either a virus has affected it or some other underlying disease. Those would be the two big ones that I would think of, but certainly in this country, sudden cardiac death is far and away caused by coronary artery disease in a person of this age.
So those diagnoses lead to something that causes the sudden death, or
it leads to disorder. Those diagnoses can cause sudden cardiac death by just causing a disorder of the heart rhythm, which is what actually causes people to die. That's the common way everyone dies. Mm-hmm. But in this particular disorder, you have a spark that gets set to make the heart become disorganized, and the rhythm basically stops. The symptoms that she manifested, such as shortness of breath, fatigue, could be an indication that she had some kind of congestive heart failure that was either undetected, but it could also be coronary disease. In women, there can be some atypical presentations of which unexplained fatigue or unexplained shortness of breath could be a symptom of coronary artery disease rather than chest pain or discomfort.
Okay. Well, that's certainly sad, Tom, and our thoughts are with you. Sudden death occurs in athletes and young folks too. What sort of diagnoses do parents and the athletes themselves need to worry about there?
Right. So in active adolescents, particularly athletes, the number one cause of death is something called hypertrophic cardiomyopathy, which is a disease of the heart muscle that causes thickening of the heart muscle, and it causes a disorganized structure in the muscle cells and predisposes people to have sudden onset of abnormal heart rhythms that puts them at risk of sudden death. And this risk of sudden death is definitely higher if they're very active or competitive athletes. And so that's the number one cause. Sometimes there are clues in the history or the family history that may bring this diagnosis to light before something bad happens. Unfortunately, sometimes it's just silent, and it's nobody's fault that it was missed. There are other causes, such as anomalies of the origins of the coronary artery, unlike in the adult world where you have acquired abnormalities and blockages of the coronaries. In the pediatric world, they could just have formed abnormally and just came from the wrong place in the aorta, and this predisposes them to get kinked and get suddenly blocked during exertion. We call this anomalous origin of the coronary artery.
Very good. So certainly your child should be evaluated by a physician before participating in sports to look for those defects that you all have talked about. Yes. Well, we've been talking about heart health with Dr. Anthony Marisi and Dr. Malik El-Yamen. Thank you both for being with us tonight. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Doctors on Call will be back live September 22nd. Join us then. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.